Dr. West, my grandson is having growing pains. We're worried about giving him ibuprofen or Tylenol, like the doctor recommended, any other options. Okay, so growing pains is what happens when in kids when their growth rates are growing too fast. The bones are having a lot of metabolic processes and changes, the growth plates and things. And they're again, they're around that periosteum, which is a sensory um, membrane that goes around the bones. And so what happens is, with kids is a lot of times they don't notice it until they are going to sleep. They don't notice it during the day because I think that they're just movement and they're active. And then those bones ache, and usually it's a deep ache. Sometimes baths, Epsom salt baths work. But I just wanted to review calcium metabolism and tell you what you can do for kids that have growing pains. Number one, there's 5 steps to calcium metabolism. This is so important for your kids and your grandkids to know this because I've seen it stop growing pains literally in 7 to 10 days and usually keep them away. So, what happens is calcium is the most abundant mineral in the body. It's what is the primary source of in bones. And if calcium is in the wrong place, bad things happen. And calcium is in the right place, good things happen. So when you have calcium in the wrong place, it can settle out. You can get bursitis and osteoarthritis and kidney stones and cataracts. If you don't have enough calcium, you get weak bones and you have a poor immune system. So we want it to be talking about soft sources of calcium, calcium malate, calcium glycinate, calcium lactate. We want to stay away from calcium that's too hard, primarily calcium. Um, oh, now I'm having a brain squeeze here. It's what's in Tums. Calcium carbonate. Thank you. Calcium carbonate is like eating cement. It's just too hard. It doesn't get absorbed very well. So if you have someone that has growing pains, the first step, soft calcium. And then we need a reasonably acidic stomach. So this is where the apple cider vinegar or enzymes start coming in. And then vitamin D3, cholecalciferol, picks up calcium out of the stomach and puts it into the bloodstream. And then what puts it into the bloodstream is bioflavonoids and unsaturated fatty acids. What activates it in the bones is K2. So we have to have acidic stomach, soft calcium, vitamin D, bioflavonoids, which are, basically the colorful things inside of your diet. So cantaloupe, squash, peaches, stuff like that have bioflavonoids in it. And then vitamin K2, which is spinach, kale, Swiss chards, basically green things. If we get that combination into kids, calcium D3, vitamin F, or what they call bioflavonoids, and vitamin K2, you can make growing pains go away. So a really neat natural treatment for that is you don't have to give aspirin, leave Tylenol, ibuprofen, etc.